a production of the Mesa Chamber of Commerce. Visit us at mesachamber.org.
Yeah, good morning, everybody. Today's kind of a bittersweet day for me personally. I'm going to step aside as co-chair of this committee, just my personal time commitment with my work schedule, as Sally knows, is pretty darn hectic in my role. So I wanted to ensure that this committee got the attention it needs. When Sally came with this idea, gosh, I think probably 2 years ago now, to get this committee together with Sherry as the co-chair, and looking where this committee has grown, the participants, the content, shoveling through the COVID situation and keeping the glue together on this committee has been an absolute joy and an honor to be a co-chair of this committee. And to see it continue and to grow, I felt it was best to have a conversation with Sally. And we are going to transfer over to Todd Jaramillo as the co-chair with Sherry. And thank you, Sherry, if you're in the room there, for everything you've done and working with you on this great committee. And Sally, thank you for your leadership and the Chamber's leadership to come together and tackle such important issues in the Mesa community. So I'd like to introduce my colleague, Todd Jaramillo, who will be taking over from me. I know he's going to do a great job. He's a healthcare visionary. It's been a great leader in our organization, and I know he's going to continue to get this committee with Sherry to a place and working to better the Mesa community. So with that, I'll turn it back over to Sally, Todd, and Sherry. And thank you, everybody, for it's been an honor to work with everyone over the last couple of years here.
Thanks, Glenn. We appreciate all your support. All yours.
All right. Well, good morning, everyone. I know I've been part of this committee for a few meetings. I would say, I don't know, over the last year or so, I've been able to join. So I appreciate the dialogue up until this point. And I know I have big shoes to fill, and my job is not to fill them. It's to try to continue to move this this council and this committee forward. So I will do the best I can, and I know with the group that are already participating in this meeting that we will have nothing but bright skies ahead of us, and look forward to the continued dialogue to move Mesa forward towards healthcare and the aging committee. So having said that, I see we have an agenda here. I don't know if everyone has it up or has it in front of you, but we also have a speaker today that we have worked through the Maricopa County Public Health, in which we've got a little bit of an update for everyone as it relates to unfortunately, the Delta variant that we have to talk about with COVID, but I think it's important to hear some other insights and information, and we will allow for our speaker, Beth, to have a little bit of time and then do a little bit of Q&A. So having said that, I will turn it over to Beth. And Sally, I don't know if you guys have been working through the technical piece, so we should be in a good spot.
Yep.
Okay, well, I want to say good morning and thank you for inviting me on behalf of the Arizona Partnership for Immunization, TAPI. That's the group it's a bunch of professionals who come together, try to promote immunization. And I'm a volunteer with the Maricopa County Health Department. I'm a registered nurse. And I'm here to talk about Delta and just a few other things. I think we all know that vaccines can help us reach herd immunity without the risk of severe illness and their death. And I hope, because you all seem to work with the older people, that all of you are vaccinated. And if not, I hope that you'll consider doing this, because it's an important time in our planet to do something about this pandemic. Some of you are old enough to know that there used to be a thing called smallpox, and even carry a little scar on your arm. And that was eradicated in 1972 because it was a worldwide push to inoculate people. And so they were able to get rid of that. And polio was another big thing when I was a kid. And, it's pretty much under control. There are a few countries that still have some cases, but it's pretty much eliminated in the United States. And you've probably heard that there's a new mandate on the horizon for staff that works in any facilities that, right now it's nursing homes, where they have Medicaid and Medicare patients. And that we can expect to see that sometime in the fall. And any facilities that aren't in compliance are going to lose their Medicare and Medicaid funding. This is going to be under CMS regulations, and they're developing it with the CDC. I probably don't have to tell you this, but why would it be important for all of us to get vaccinated who work with an older population? Well, we're working with like the most vulnerable people. I could have just put a picture of me and my husband up here, but I thought this would be a little more amusing. As the NIH says, the aging immune system loses the ability to protect against infections and cancer and fails to support appropriate wound healing. Vaccine responses are typically impaired in older individuals. And the data showing that some people that are getting the breakthrough illness, which is mostly Delta now, who have been vaccinated, tend to be older nursing home residents with 3 or more underlying medical conditions. And staff, of course, are considered one of the main triggers of nursing home outbreaks, and that's true in hospitals and other settings where people get what they call nosocomial infections and other things like that. This is another obvious picture here, but the more people are vaccinated, the less likely the exposure will occur. So if you have all the blue people not vaccinated and you only have a few people that are yellow, you're going to get a lot of sick people, but you're going to do a lot better if you have more yellows in the mix. You're going to have less outbreak. Now, one of the problems we see with vaccine hesitancy is a lot of the fear is around the fact that they were able to make a vaccine so quickly. And that shocked me too. I mean, it's kind of shocking, but we are in an age where things happen quickly. And the Pfizer and the Moderna are of particular concern because it's a new technology for humans getting vaccines. The mRNA, the messenger RNA. But there's some information that we can share with people that are worried about it. And that would be, for instance, the mRNA vaccine phase 3 trials started in July of 2020. So they've been studying the long-term effects for over a year, and they have not seen any in the millions of vaccines that have been given. Also, people think that the vaccine stays in your body and changes everything about your body, but that's not true. It leaves the body in about 72 hours after it delivers the message, and then our antibodies take over and do the work. The vaccine cannot give somebody COVID-19. It doesn't use any virus at all, any live virus at all. And so it's not going to give a person that. And that's, people believe that about almost any vaccination. The vaccine does not enter the nucleus of the cell. It's not going to change the DNA. The vaccines are new, but the technology is not, it's been studied for decades already. And one of the big advantages of the mRNA vaccines is that they offer shorter manufacturing times because they don't require the use of a virus. So now there's, question about, are we going to have to have a booster? And I think that's really still actually on the burner. It hasn't been, even though President Biden announced it, it's not, the FDA has to be involved in it, the CDC, the Advisory Committee on Immunization Practices. So it is being offered to people, and you may have some clients that are already getting that booster, but it's another, okay, it really hasn't been like stamp of approval by these things, these people in charge anyway. So, and of course, we know that a big reason to get everybody vaccinated is to help stop the production of variants. And that's where we're getting on to our Delta variant. I love what Dr. Fauci said on a show I saw, that this is what virologists all know, that a virus will not mutate unless you allow it to replicate, and you give it free rein to replicate when you allow it to circulate. And this is exactly what's happening. What came out today, there's a new one they're studying, the World Health Organization is looking at, called the Mu variant. So there are many variants. The Delta right now is the prominent one. But I like that what they said in their report today, and that is that all viruses change over time. Most changes have little or no impact on the virus's properties. However, some changes may affect the virus's properties, such as how easily it spreads, the associated disease severity, or the performance of vaccines, therapeutic medicines, diagnostic tools, and other public health and social measures. So this is a concern, that the more that it's spreading around, we're getting more variants, and some of our measures now that are working pretty well aren't going to be working. The Delta variant's the most prominent one now. They think at least 80% of cases are Delta. It spreads 2 times as fast as the other variants, and there's more than one variant. There's an alpha and a beta and a kappa and a whatever. There's all these other variants, but the Delta is the prominent one. It seems to be maybe causing more severe illness than previous strains. And fully vaccinated people with a Delta variant who experience breakthrough infections they're finding could infect somebody else. So we can be carriers before we're even sick and spread it to somebody else. The symptoms of the Delta variant, they're similar to the COVID, but they seem to have more of the upper respiratory signs, like a sore throat and a runny nose, but they also carry the weakness, the shortness of breath, the coughing. Finding information, it's an ongoing thing. Believe me, I've been working on this for a while, and everything gets outdated so quickly because we're working in real time. But this is the latest one that I was able to bring down that shows Maricopa County, and this is the CDC COVID tracker. I looked on the Maricopa County. They don't have a list like this exactly, and some of their stuff is outdated. But this one comes out every week, and this is from last Friday to last Thursday, a week ago. So yeah, we're already old on this. In community transmission's high, cases are high, positivity rate, which we wish was 5% or less, is hitting 11%. And our eligible population of vaccinated people is still very low. It's probably a little higher now than this was last week, but still, we're looking for like 80 to 90% to help with the herd immunity, and we're only at about, a little over 50%. I had a little extra data that came in about how many cases were added in one day. There was over 3,000 cases from between Monday and Tuesday. It was 3,400, I believe, and 33 deaths in the Maricopa County. So it's something that is ramping, it's been ramping up. So we need to take all the protective measures that we were doing before. And that goes back to my pet peeve is the mask, that it's something that we should be doing because it, as the World Health Organization says, they're a key measure to suppress transmission and save lives. So wearing a mask is still important, but also what's important is like the type and the fit of the mask. So as you can see, there's the right ways and the wrong ways. And if you're going to use a surgical mask, like the regular paper surgical mask, it's about 38% effective if you're wearing it just without modifying it, because there's usually some gaps in it, but you're going to get better filtration, maybe up to 60% if you have it where it's really secure and covering your nose and mouth and against your face. There are the K95 and the KN95 and the N95 masks. Those are, the KN95s are very available. They are the medical mask for China. Whether or not you like China, I don't know. but a comparison done by a company called smartfilters.com showed that they both filter 95% of 0.3 microns particles, which is very good because the virus is carried on saliva and secretions, which are somewhere between 5 and 10 microns. So it's very good filtering. So I've been using the KN95 now. They're very, very easy to get. If you're in a facility, you might be getting the N95s, and that's great. Let's see. So what can we do as health providers and advocates for our seniors and other people? Obviously, get vaccinated if you haven't been vaccinated. Wear a mask when indoors around people you don't know, whether you're vaccinated or not. Always wear a mask when you're working with any vulnerable population. Practice good hand hygiene and look for valid scientific information and share it with the people you know. I like the news things that I watch, and usually what it does is trigger me to go back to the trusted sources and see if it's really true or not. The other important thing is to stay updated and make sure you look at when an article was published. Because we're working in real time, things happen a lot faster, and out of the blue, something else new comes along and things are changing. So always check to see if that's like the most current thing. Oh, and also don't work and be around people like that if you're sick. The other thing I recommend, and the patients that I see don't seem to always know that that the vaccine is 100% free, whether you have insurance or not. So they will be asked if they have insurance, but they don't have to have it. And sometimes that's the factor that gets people to go get their vaccination, is because they find out that it's for free and they don't have to worry about that. This is just a list of my trusted sources. There's a lot of them, but we do have a wide variety of places to go to find information. And if you're looking in one place and it's not been updated, you can go look in another. Google's been a lifesaver for me to get information, because nothing like this is in the textbooks yet. So I can't pull out any textbooks and find it. But just make sure that you're looking at the dates about when they've been published, because if they're a month old, they're sometimes very old already. And there's also, for helping people find a vaccination clinic nearby or where to get it, they're available all over now. But my group, TAPI, started this months ago, before it was it was easy to find a place. And so there's many places you can look to find out where your nearest location is and what they offer. This is just one source. And with that, if you have any questions, I think I was supposed to maybe check the chat, but unfortunately, I can't move my cursor when all of that is going on, and I'll stop sharing there. Okay, so let's see. Okay, so somebody had not heard about the Medicaid and Medicare Medicaid mandate, and because Medicare and Medicaid are federal programs, it's just like if you fly on a plane, it's FDA, not FDA. Yeah, yes. Federal, yeah, you know what it is. Sorry, see here, you work with a lot of people like me, right? President Biden can mandate anybody that's working with that federal program. So it is, the information is on there. If you look it up, you can look it up online. In fact, I would say Google mandate. I believe it was under the CDC website. I believe that's where I found it, but you should be, or just, you can look through your Medicare or Medicaid thing and ask the question. And I still have anti-vaxxers telling me, oh, I hope, did that answer your question, Lori?
There's I work at a senior living community. And so this relates directly to me. So I'm interested to find out what the parameters are going to be with that. If it's
I think they're working on it, like they don't have it. You can expect to start seeing it in the fall. And I haven't seen any list or anything of exactly how they're going to do it. But again, it's going to take a while to roll out because people who work with CMS probably know how long it takes to get the ball rolling and get to your facility. It may just be they're going to go around to the facilities and do a checkoff like they do to certify you for any other things. That'll be one of the checkoffs on the list. Or it may be they're going to send a lot of people out right away. I mean, this is a fast moving thing. We don't have time to sit around. So I don't know exactly how they'll roll it out.
Thank you for the information.
Yeah. And Becky says, I still have anti-vaxxers telling me all the reasons the vaccine is not that important. Oh, well, thank you. Yeah, they're not.
It's painful. It's painful talking to people because they get so worked up and excited that it's not really a good place to try to win them over. So many people I know in the medical field, I am just so surprised, and they do not trust the government at all. I've gone to sites like Mayo Clinic, Johns Hopkins. I've gone to some of those as well as government, but it's hard to talk to these people. So I'm wishing somebody would step up that people would trust and listen to. I know it's not me, but any like quick talking points, just to at least maybe get them to open their minds, but I'm not real hopeful.
Well, that is a problem. And I mean, I've worked at some I hate to say this, I've worked at some vaccine clinics where some of the people actually giving the vaccine aren't going to get the vaccine. And to me, that is, I've been a nurse for over 40 years. I mean, if I'm not going to do something, I'm not going to do that to somebody else. And it's just like, I don't know what to say to those people. I think what's important, the things that I've found work in the community where I volunteer as a nurse, is I try to come up with every possible, not argument, but first of all, I do bring up the fact that, and some people are too young to know this, but there used to be smallpox. And I'm old enough, and I don't mean to say that, Becky, you might be old enough to have this mark on your arm, but you'd have to be born after 1972. So I'm going to assume, things like that, saying, the reason that your kids aren't getting vaccinated for smallpox, which was killing people for centuries, is because of vaccines. The other thing is the technology. This is the technology now. This is the way it's going. And it's relatively safe. They're not using, I mean, if you're allergic to polysorbate, or let's say polyethylene glycol, which is Miralax, and how many people are allergic to Miralax, you're pretty safe because there's no egg products in the mRNA. It just delivers a message about the protein. You're not putting any live virus. I mean, it's a miracle. It's a miracle. And, unfortunately, they had to roll it out in an emergency basis. And so that's been putting everybody on oh dear.
And conspiracy theories.
That you're never going to hit those people.
I respect otherwise. I find it strange, this lady who says, I'm not putting anything like that in my body. She says that and then goes out for her smoke break. And I'm
right.
There's quite a bit of evidence about how harmful smoking is for
right.
you.
Well, another thing is to say, and if you were sick and had to go to the hospital, let's say you had cancer, you're going to let them do chemo unless you're a person who's not. But, most people will start some chemotherapy, which is something produced in a laboratory that has a lot of things that kills a lot of cells, by the way, healthy cells. that changes your hair, that makes you lose your hair, that you would do all of these things in an effort to become well again. And here you have an opportunity to not get sick and not get long COVID, which is another issue, the long COVID syndrome that people are suffering long after they've been sick. And the other thing is we've got to protect our children and our elders. And if they're family members, I just, my personal bias is if you're not going to be willing to protect yourself enough to help protect others, then you shouldn't be working in the medical field. That's just me.
Well, I was going to ask you that because I'm proud of both my grown children who are not in the medical field, excuse me, who found it important to get vaccinated. But I don't understand why so many people in the medical field, and I'm talking about kind of frontline hospital workers, especially. I'm not understanding why they're so unwilling when they take care of people every day. And I lost my sister-in-law, who they think got it in the hospital at her husband's bedside, who had cancer. I lost her to it. So, and I know I'm one of,
I'm sorry.
how many out there. Why are the people on those front lines so unwilling to take that risk? I feel like if I die from getting the vaccine, I still helped mankind.
It's the patriotic thing is sometimes what I've said. It's a patriotic thing. If you really, I would not go, I did not join the armed forces or anything like that. I'm too chicken for that. And I appreciate and thank people, veterans, and any of you out there. I thank you for putting your life on the line for me. This is one way that I can serve my country.
Right.
And it's actually a really safe, it's safer than not doing it. So.
Safer than a lot of other things, I believe, that we face every day.
Yeah.
Slow.
All right. Yeah, go have your cigarette now.
Yes.
Okay. Any other questions?
Anyone have any questions?
I have a quick question. How does a lot of people talk about the vaccine number, but don't talk about the number of people who had COVID and have the natural antibodies. How does that layering factor into herd immunity?
They are doing studies on that, and they don't think that you keep the immunity for as long. And now that the Delta virus has the upper hand, I believe what they're finding is that your immunity, I don't think that the verdicts come out, okay, but that your immunity to the new strain, when you have natural immunity from having the original strain or one of the earlier strains, that it doesn't necessarily carry over. So that is why they recommend that even if you've had COVID, that you get vaccinated after your symptoms are gone. One of the problems is, we don't all get tested for antibodies. So we have no idea, right? I'm an older lady, but I feel I'm in really good health. I take care of myself, but I don't know if my shots are still working that well. And there's many things we have to get, you have to get a new tetanus shot every 10 years. You have to get, oh gosh, what have I had? I had so many vaccines in the last year and a half. Don't get old, guys. So there are things that wear out. They unfortunately just don't know. And the reason they're thinking they want to do boosters is because they want to get on top of it rather than wait until more people get sick. And they're finding that against the Delta strain, severe illness and hospitalization is reduced dramatically if you're vaccinated with, one of the original vaccines. So, but I don't think there's enough. I don't know what information is out there really. That's why they're still advocating for you to get a vaccine, because they have to study all the people who had it to see how long it lasts. And
yeah, I haven't seen a lot of science on it either. That's why I was curious about it. I had it in January. I got vaccinated with the Johnson & Johnson vaccine, not the mRNA ones. And so I have some questions about, okay, how does that all play together into the future? And how does that then factor into greater herd immunity? So it'll be interesting to see how it all
Yeah,
plays.
I've always wondered that, but gosh, you just don't want more people to get it for that purpose, you know, but yeah. Well, thank you for getting your vaccine anyway. I mean, a thank to anybody who got their vaccine. Like I said, I think it's a patriotic thing to do. It's a humanitarian thing to do. And unfortunately, there's a whole world out there, you know, that isn't able to get the vaccines like we can. So that's one other thing I say, we are the luckiest people. We're such a lucky country that we can all go and get a vaccine for free against something as dangerous and deadly as this. I mean, not every country has that. All right. Anybody
Thank you.
else?
Thank you.
Okay, well, thank you. Take care, everybody. Keep healthy.
Thank you, Beth. I appreciate your time.
Alrighty, bye-bye.
All right. Well, I think it'll be interesting to see kind of what happens as this evolves. I think the other hot topic right now that I think everyone can, if you turn on the news, is about children and schools and what that's going to look like. So I anticipate there'll be a lot more to come, especially by next meeting around some of those topics. So interesting. We appreciate Beth's time. Hopefully some of that information will be helpful or something you could take back to your organization. Obviously continue to research, and we'll share what we can whenever we get it, but very much appreciated for that. Moving on the agenda, we've got an update from the Congressional side. So I apologize if I butcher your name, but is it Ashia from Cinema's office?
Hi, good morning. It's actually Aisha.
You were close. We were
yeah.
close. We're here. I apologize.
Not a problem. Okay, well, I'm actually taking the place for Michelle this morning. Thank you all for having me join. I really appreciate the opportunity to learn more as well from Beth. So the updates we have for you all is that the FDA and the CDC are still working to set up getting everybody booster shots for the mRNA vaccines. That would be the Moderna and the Pfizer vaccines. That will be happening around September 20th. And for people who are already aware that they're immunocompromised can get the booster shot right now. They just have to work one-on-one with their medical provider, and they would be able to get that. The Johnson & Johnson vaccine, right now, they don't have enough data yet to support a booster recommendation, but the FDA and the CDC are confident that it will also require one in the future. So to be released once studies have supported the data. The last thing I have here is that the majority of time in Congress before the August recess our office was spent with passing Senator Sinema's bipartisan infrastructure bill. So that's just to update you all on what our office has been working on. And as always, if you have any questions or concerns, you can always email those to Michelle. I know she attends your meetings regularly, and she's a great resource to you all. So feel free to ask any questions that you may have. And just to add to what Beth was bringing up earlier about the nursing home regulation that is working to be implemented. It is not yet implemented by CMS. They're working out the details. So that's to be released, but it looks like with the Delta variant, there have been so many recent outbreaks located in these nursing home facilities. And they're seeing that they're caused by low staff vaccination rates. So currently, as of August 25th on the CDC data tracker, they have a website, can post it in the Zoom meeting. And it shows that currently there's about 61% of nursing home and long-term care facility staff that are vaccinated. So in the past, it seems like there's been a push to encourage staff to get vaccinated, but it doesn't appear that that has been so effective. So it appears CMS is implementing this new regulation in hopes it will ensure the safety and health of the residents in those facilities. And that's all I have. And thank you so much again.
We have a few questions. Lori, go ahead.
Yes, if I could just ask a follow-up question to that mandate. Does it sound like there's going to be a mandate that if you're working in a nursing home environment, staff is going to have to be vaccinated in order to work there? And if that's the case, would they be putting a deadline by a date that those people need to be vaccinated by?
From what we're seeing released by CMS, it would be any nursing home that is receiving CMS funds. So that would be nursing homes that are serving patients with Medicare and Medicaid. So, and also, sorry, to go to your second question, it hasn't been determined yet on when, if there is a deadline and what that deadline will look like. Unfortunately, CMS has only kind of put on everyone's radar that they are working on this new regulation, but they haven't released any other information to provide to the nursing home communities yet.
It's gonna, I mean, as I mentioned, working at a community, it's gonna be very interesting to see how that mandate is going to roll out, just because we're having such a challenge getting care staff as it is. I mean, I understand the validity in it, and I know that Banner went through and did that, and there's some other organizations that did that, but it's going to be really interesting to see, especially when there's so many younger individuals that are working in these environments, and that for our situation at least seems to be the group that is not wanting to get that vaccine.
Yes, and we have also heard concerns, and I'll definitely be sure to send that up the chain to our policy staff in DC, concerns, especially in the rural communities, that staffing has been a concern, and they're worried about this regulation being in place, exasperating the already existing staffing capacity concerns.
And Will and Becky is making a question of not impacting assisted livings, but Becky, why do you think that?
Assisted livings don't get any help from Medicare. So they're private pay or long-term care. I guess there may be some, I don't know, but normally that's just skilled nursing facilities that Medicare is covering the cost for the people who are there.
That's my understanding as well, is Lori, what it's focusing in on is the skilled nursing facilities, not the memory cares and the assisted living.
Right. Okay. And so you don't think it's going to trickle down to an Altex piece where if the state is going to be paying for some of the care, they're going to be mandating that piece?
I think that remains to be seen, of course, but definitely not based on federal government.
Good, good distinction. Thank you.
I had one question as it relates to the booster starting in September, end of September. Is there any discussion around tiering it again as they did with the rollout of the initial vaccination?
To our knowledge, yes. We have heard that it will be rolled out similarly as the initial vaccines were rolled out. It does sound like it's going to be up to state and counties as it was before to decide who gets what, but it sounds like it will probably be the same. But it hasn't been released yet, but that's what we're hearing.
Perfect. Any other questions? Appreciate the update.
You're welcome.
Thank you.
Thank you.
Hi, Forrest.
All right, next on the agenda, we have a few breakout rooms.
Well, which we won't actually do breakout rooms since
We're
we're
not doing
hybrid
breakout
today,
rooms.
but we're gonna talk about these things.
We can
so,
talk about them.
Yeah.
So I'll give a little bit of a Dementia Friends update with my friend Karen.
Hey, she's all of our friends.
Okay, I'll share her. She's worth having on your friend list for
Yes.
sure. So there hasn't been a whole lot of movement, just continuing to work through getting people trained as champions. And then also an idea has come up over the last couple of weeks to get cards made that family caregivers can hand out when they're in the community to be able to slip to, a waitress or a worker at a business that just says something more slick than what I'm about to say, but my loved one has Alzheimer's disease and may have behaviors or may need special assistance. So that way you can communicate with somebody what's, about your loved one's needs without embarrassing your loved one. So Sally has graciously agreed to printing some of those for us. So we'll have about 200 printed that will help with kind of marketing as well of what's going on in Mesa. Karen, do you want to add anything?
No, you did a wonderful job, Sherry. That's good. Yeah, I sent out the card can be anything we want it to be. So it can be as simple as my loved one has dementia, please be patient, or it can have indications if they repeat questions and those kinds of things. And then on the back, I was thinking this morning, maybe if your business wants to be involved in Dementia Friendly Mesa, here's how you would get involved. So we can talk about that in our committee meeting. And then we're still needing to finalize some of the finer points of the business initiative. So we can do that either in a separate meeting with our committee or in a breakout room next time we meet. So that's where we're at. COVID has really kind of stalled everything right now.
It looks like we have a message. So there's just a note in the chat for you guys. There's a link available for more information. Okay, anything else on Dementia Friendly?
Nope, that's it.
No. Cool. Todd's here to talk about any technology stuff. That Todd.
Yeah, I was like, you're looking at the wrong person here. The person who couldn't unmute.
In the picture.
Yes, get in the picture.
Where am I at?
As soon as you speak, it's gonna come to you. There you go.
Okay, so on technology side, we did, end of July, we did a technology conference or a technology fair. And one of the big things that I saw that made a huge impact with seniors with dementia is virtual reality goggles. And so we have a set to where I can take multiple people at a time on this, but we had one resident that would go through the virtual reality goggles, and I could take her back to her front door of her house that she grew up in, or some childhood memories with this. And you should have seen the joy she had on that, and her husband coming back to me and saying, how do I get more of these? What do I do? And the aspiration of what the husband had of seeing the joy in his wife that had dementia, it was something else to see. But there's being able to pull back, because a lot of people with dementia, they revert back to their childhood, and taking them back into those places to where they can see their childhood home and stand in front of their house, or to sit in front of 30 golden retriever puppies with these goggles on, and they're literally reaching out, and the smiles on their face, and you just see a lot of extra joy that you normally don't see in somebody with dementia. But a bit of technology, if anybody wants to come and talk to me more about what we're doing on that and how we're doing it, feel free to get a hold of me.
That's cool. So are those glasses available for people to actually purchase and have at their homes?
You can get 3D goggles, but the programming side is not. I mean, there's some very specific programming on that it's very specific towards people with dementia. But you ought to come by and just see what this is all about. It's the joy that you see it's one of those, hey, this is why we're in the senior living market, is what you see. So
That's awesome.
anyway, that's my bit of technology for the month or so far.
That's cool. Very cool. I want to see.
Yeah, sounds awesome.
All right.
I could take them skydiving too, and that's something else that's just to watch them do that.
Oh my gosh.
But if you look at it though, you look somebody that's almost bound in a wheelchair. I can take him to the Taj Mahal or skydiving or scuba diving. One guy was a Marine, was in the Navy, and he would scuba dive, and to take him back under the ocean to see the dolphins and fish. Scuba diving is something else, or to take somebody skydiving or on a gondola ride in Venice or
Very
with
cool.
some other people. So you can take them literally all over the world without having them within the safety of their chair they're sitting on.
That's awesome. Very
So,
cool. Thank you.
anyway.
Good update.
I think we have our COVID update.
I was gonna say, I think we already-
Does Lynn have something, or Cindy?
Yeah.
Cindy's on the call from Dignity.
Hi, guys. Yeah, I can just say things are very busy. All those in healthcare know that right now. Our ICUs actually, this is the first weekends in a while where our ICUs are completely full. Even at the little Mesa hospital, we've been at 150% of our ICU capacity. So this go around with the pandemic, we're seeing a lot more other conditions. So it's not just COVID. We're seeing folks come in with other conditions, whereas the last time we really just saw COVID patients. And then just to speak to the vaccine, everybody probably knows Dignity has a mandate in place as a November 1st requirement to have the vaccine. We are aware of some of our staff throughout Common Spirit Health, but also throughout the division for Arizona that are going, or either asking for an exemption or refusing the vaccine, and unfortunately will be no longer working for the organization if they choose not to get it and do not get an exemption by November 1st. So we have a lot of videos and stuff out. I work with a physician he's an ED doc, but he's a researcher. He's done a lot of research with the COVID vaccine actually, and participated in the original Moderna research studies. And he's conducted quite a few studies for Dignity Health with the vaccines. And he's done a YouTube video that we have sent our staff to do he had a lot of FAQs there answering questions that we're getting a lot from our staff, especially the younger staff, the younger female staff with concerns about pregnancy and or infertility because of the misinformation that had been spread in the very beginning. So, I mean, we're trying to find other ways to connect to our teams to help alleviate their concerns about it. But I think we're all in the same boat. Many people just have an innate fear of the vaccine.
Cindy, do you know offhand if what percentage of those staff you guys are anticipating or expected to not, I would say, conform with the requirement?
Well, we have like numbers for Common Spirit wide. So for all 142 hospitals, we know that we're required to do a survey right now, a vaccine survey. And if you've had the vaccine, you have to take a picture of the card and send it to Common Spirit. There's 124,000 surveys that they sent out, and I believe 80,000 of them have now been completed, and 12,000 of them are asking for exemption. 3,000 people have said that they're not going to get the vaccine or ask for an exemption.
Wow. Aren't you already short-staffed?
We are very short-staffed already. I mean, we definitely have huge concerns. We've reached working with the state right now on kind of what we can do to try to encourage more nurses to come here. The problem is that, like Texas, for instance, they put out a request through the federal government for 8,000 nurses. We know that there are 65, I believe they said 65,000 open traveler nursing assignment requests right now in the United States, 65,000. And that will obviously increase with the mandates, because we're not the only ones that have mandated. Many healthcare organizations have mandated the vaccine. So we're all in the same boat here.
Wow.
Interesting. All right. Anyone else have anything? Go ahead, Cindy. I'm sorry.
I was just going to say, this morning they notified us that they're going to declare the nursing shortage kind of like a national crisis today, is what we've been told.
Sounds like a legit
Concern.
yeah.
Yeah.
Wow.
Any other comments or questions, as we already had our discussion, but love to hear from anyone else. If anyone has any thoughts.
I think we have PD and fire on. Do you guys have any updates? Mesa Fire, Mesa PD?
Good morning. We don't have any updates from our end right now. We're still doing our social service assessments in person, in people's homes, masked, of course. And so if anything changes, we'll have to go back to either porch visits or not doing that work for right now. So that's kind of where we're at in the social services division of the department.
Can I ask Fire a question?
Absolutely.
Yes. So something that has been going around the senior communities is hearing what, and kind of go with me loosely on all the specifics, but group homes in the Mesa area, how they're being reevaluated with their occupancy and their availability to have residents that may be bedbound or not able to self-rescue, and how the conversation is going to be looking to evict those individuals that don't have that. I know that, there seems to be some conflict in the information that DHS goes and approves these group homes to be able to be space, to have people there. And now, okay. And then now the question is, how is Mesa Fire suddenly coming in and reevaluating the occupancy piece? So maybe you can provide a little clarity, because I know there's a number of us that are involved in that senior housing kind of dynamic. So I just would like to hear it from you directly.
I can provide a little bit of information, but what I can also really tell you that this has been elevated to the city PIO level. So what you're referring to is actually a 20-year building code. So it's not anything that's been new. And as far as the evictions, no one's being evicted, but it's not new code enforcement. This has been something that's been in place for 20 years. If you have more specific questions, I would really encourage you to go directly to the city PIO, because right now it's kind of a work in progress between our city PIO, DHS, and the Attorney General.
I think this is a really serious topic that we'll hear more on, and I will reach out to them. I am concerned because I know it's been in place a long time. What I'm hearing, and I'm with Lori, we're hearing both sides. I'm hearing that even though it's been in the books, it hasn't been enforced when all these people open these group homes. And I know there's a very real need for group homes as well as big senior communities like Lori is with, and that they're being told they will be fined a very, very large amount if they have anybody that's not self-preserving, that could get out in case of a fire. And so many of them will either have to evict these people or just go out of business because they're not a big business that can afford huge fines. So the concern is what the outcome will be. And I really want to listen to both sides of it, but it is a very serious issue.
Absolutely. Yeah, I think reaching out directly to city PIO on this issue is the best way to get the most direct information. This is basically what I've been instructed I'm able to say.
Great, good discussion. So given the time, I know some people have other obligations and I want to be mindful of everyone and respectful of everyone's time. Looking at the agenda, we had the Aging and Healthcare Expo. What I'd like to do is kind of move that to next month. That way we can continue the discussion. I think it's worth it. Real quick, does anyone have any other, moving to item 6, any ideas or suggestions as it relates to a speaker moving forward? If you don't have one now, I would suggest email anyone. We're happy to look for ideas, concepts, or as things evolved, we'll definitely take anything into consideration. So if no one has any ideas or concepts or questions at this moment, we can try to adjourn this.
Good to see everyone.
All right, well, hearing nothing, I think
good.
we'll call it a meeting, and thank you again, everyone, for joining, and we are 1 minute late, I apologize.
Thank you.
Stay connected to Mesa Chamber social media, email newsletters, Monday morning message, and mesachamber.org to always know what's happening at your Mesa Chamber.